Hello, everyone, and thank you for joining us for today's video presentation. My name is Jared Deason, and I'm joined by my colleague Jessica Elliott. And today we'll be walking through the highlights from CMS's Quality Payment Program 2024 Notice for Proposed Rulemaking. On July 13th of 2023, CMS released the 2024 Medicare Physician Fee Schedule proposed rule. This rule not only covers the quality payment program, which we will be focusing on today's video, but it will also pertains to Part B billing under the Physician Fee Schedule umbrella. If you would like to dive into the guidance yourself, we have included the links here. The proposed rule is roughly 2,500 pages. We also included the links to the various fact sheets that were released hand in hand with the proposed rule. CMS does encourage comments on the proposals that they made. Comments will be accepted until September 11th. These comments can be made in a variety of ways and can be submitted by individuals, groups, and professional organizations. So the Quality Payment Program came about with the macro legislation and continues to evolve as we prepare to enter year 8. There are two main ways to participate in the Quality Payment Program. That is the Merit-Based Incentive Payment System, better known as MIPS, and the Advanced Alternative Payment Models, better known as APMs. Within the MIPS track, eligible clinicians are subject to performance payment adjustment of up to 9% and or a negative payment adjustment down to 9%. The other option is advanced APMs, and qualifying participants in approved CMS APMs can expect to have additional incentives that go along with the shared savings that this track offers. With that being said, I will hand it off to my colleague Jessica to talk about the meat of the proposed updates.
Thank you so much. I appreciate it. So one of the first things I want to start off talking about is eligibility for 2024. So CMS is actually proposing to make some adjustments to clinician types who have been previously granted an automatic reweighting for the promoting interoperability category over to the cost category. And so CMS is actually proposing to remove PT, OT, speech language pathologists, registered dietitians, and nutrition professionals from that exception. And so only clinical social workers would qualify as a clinician type for that automatic PI reweighting. So if you're a part of that ASC-based, you have those special status designations like hospital-based, non-patient facing, or if you're deemed a small practice, you are still protected under that automatic reweighting, but your clinician type would maybe not necessarily be protected anymore. So that is something to consider for practices who do have those eligible clinicians that should be falling into and reporting for promoting interoperability. Now, again, the eligible clinician criteria has not changed. CMS is maintaining that low volume threshold, so $90,000 in Part B, 200 attributed beneficiaries, as well as 200 covered professional services rendered during the look back period. So you have to meet all three of those criterion in order to be deemed an EC or eligible clinician and therefore required to report or participate in the quality payment program. Now, probably the most singularly impactful proposal in this material that we've read is around the threshold to avoid penalty increase. So CMS has had the threshold to avoid penalty. They finalized it for 2023 to be at 75. And there was a lot of dialogue back and forth in the proposed and final rule last year about when to make that increase. And CMS, it looks like they are flagging 2024 to be that year that we would start to see a rise up to 82 points. So 82 points out of 100 across all 4 performance categories for the traditional MIPS track or an MVP track. You'd need to be able to hit that mark in order to avoid any type of negative payment adjustment. And you can see on the right side of the screen what it looks like from 23 to 24 with that increase. Something of note is that CMS does acknowledge that they anticipate roughly half of their clinicians to receive a negative payment adjustment after 2024. So that is a significant impact. It's really great news for high performers, meaning that because this is a budget neutral program where the losers fund the winners, that there's going to be more money in that positive adjustment pool to be able to pay out those folks who are earning 82.01 to 100, if that's the finalized point system in 24, that they would receive likely a higher payment adjustment because of more funds being available. So again, it's now more important than ever to make sure you're optimizing your performance around all of the categories of the program in order to make sure that you stay out of that penalty box. Now, when we start looking at the individual performance categories, no changes to the category weightings across the big four. Everything is maintaining the same for traditional MIPS and MVPs. CMS has made some changes though within each of the individual categories. So when we're looking at the cost category, CMS has actually added 5 additional cost measures. They're proposed to go into effect for 2024. And so that is something that is going to be available for clinicians to be scored on either at that individual or that group level. Those cost scores will also translate over to the applicable MVPs as well. One other change in the cost category is their methodology around improvement scoring. So CMS has recognized some issues with the calculation and the flaws. 2022-23 were supposed to be the first years for improvement scoring to be seen. CMS is actually proposing to finalize that improvement scoring would not take place until performance year 2023. Looking at into 2024. So what you have to do is you're going to be looking at your total cost score from 2023 and comparing it with 2022. And so if you did submit and you were scored on, I should say you were scored on cost in 2022 and you were scored on cost in 23, CMS is going to look at your category level performance. Originally, CMS had finalized that it was going to be up to that individual measure performance. But again, they realized that their methodology wasn't feasible, so they're making an adjustment. It's going to be category or overall performance category level scoring. So that's going to align with how they actually do the improvement scoring for cost. Again, it's going to be a small amount, though, that could be applied up to 1% out of 100% applied to your final category score. Now, for the quality category, CMS has had finalized data completeness thresholds to be at 75% for 23 and 24, but they still hadn't finalized 26 or 27. CMS is proposing in this rule to extend through 26, that 75% data completeness threshold, and then proposing to increase it to 80% in performance year 2027. So again, that is something that is important for us to keep in mind as that projected in performance threshold is set to increase. We want to make sure that all patients are falling in and reporting into that initial population for your denominators across your measures. Something else for the promoting interoperability category that I think is a highlight we really want to call forth is an increase in the performance period window. So historically, promoting interoperability has been a 90 consecutive day window. CMS is proposing that starting in 2024, that's going to expand to 180 continuous days for reporting. So that's going to impact if you're working on any type of bidirectional exchange or HIE connectivity. You're going to need to be fully functioning at the beginning of that start of that performance period. So that window to be able to get optimized around your patient portal and all those other different aspects are going to become increasingly more important in 2024 if this does get finalized as proposed. Now, to transition over to MIPS value pathways. So MIPS value pathways is a subset of reporting right now. It's an optional opt-in only reporting that you can do that is very focused around a particular clinician type, an episode of care, a subset of patients. But it's more to help more closely align the specialty care that is provided to be able to reflect aligned quality measures, improvement activities, and cost measures for a particular clinician or a group. And so a lot of the proposed changes for this year that we found in the 2024 NPRM are really around some nuances around subgroup reporting. So subgroup reporting is a subset of reporting within MVPs. It's going to be voluntary through 2025, but CMS has anticipated that it will be mandatory in 2026 and beyond, that you would no longer be able to report as a multi-specialty, kind of like what is already done through traditional MIPS. That is going to go away in 2026. CMS has not sunset traditional MIPS yet. They did not propose a specific date to completely eliminate traditional MIPS like what we're used to attesting to. But again, with this proposed rule, the writing is on the wall that the plan is to have traditional MIPS reporting go away and us to pivot to, if you're going to be in a MIPS track, you're going to be participating as an MVP, or you are going to be a part of an APM and you're going to be somewhere in that APM APP pathway for the quality payment program. So again, most of the changes that are proposed are going to be focused around that subgroup level reporting for MVPs. One of the changes I did want to highlight is that you can attest to individual activities, improvement activities at the subgroup level. You still have to have, it's the same requirement whether you're doing regular improvement activities, but you have to have at least 50% of your clinicians within that subgroup participate in that activity. CMS also is proposing that the complex patient bonus starting in 2023, that it would be assigned at the subgroup final score. So your affiliated group, as a subgroup, you would get that complex patient bonus. It's not going to be calculated at that individual subgroup level. Now for EUCs, subgroups would be eligible to file an extreme and uncontrollable circumstances application that's separate and apart from their affiliated or their group tax ID. And so this is a flexibility that they've clarified around there. Now, they've also did some clarification around facility-based scoring. So if you are part of a subgroup right now, your facility-based scoring would not be applied to any type of subgroup attestation, simply because subgroup reporting is not mandatory right now. It would be opt-in eligible to do that. So they are not going to factor in facility-based scoring if you are eligible for that to replace your MIPS score. Now, one other aspect I want to make sure to highlight are some of the newly proposed MVPs for 2024. So you can see in the blue box, those are previously finalized. Those are the ones that are up on the table for 2023 moving forward. CMS has made some changes. They've actually taken the two primary care MVPs, optimizing chronic disease management and promoting wellness, and they're combining that into a brand new MVP called Value in Primary Care. This Value in Primary Care MVP actually aligns with CMS's universal foundational measure set that they are wanting to take and align across multiple CMS programs. And so this is that one step closer into having that foundational measure set for primary care. We also see some additional MVPs around women's health, ENT, infectious disease, mental health and substance use, as well as some MSK orthopedic MVP that's been proposed. So again, continuing to add new MVPs to be more inclusive of the different aspects of both primary and specialty care that clinicians offer. With that, I'd like to hand the presentation back over to Jared.
Thank you, Jessica, for walking us through those highlights. If quality payment program support is something you think your organization can benefit from, give us a call. Our advisors provide at-the-elbow support to work with you to identify strategies, help create targeted aims and objectives, to help your organization align efforts across a variety of programs, and hopefully ultimately help improve scores and reimbursement. We do more than just QPP. We also offer support with PCMH, HIPAA security, and we do offer a wide range of grant opportunities that your practice can take advantage of. Thank you for joining us today in our video presentation. Be sure to check out the Whova app for a wide range of mini videos around various topics. Thanks again. Have a great day.